Growing up and when I came out, I was like embraced and accepted by my family. And I thought that was kind of how it was for everybody. When I moved to San Antonio, I met all kinds of people, but they were kicked out of their homes and they were disowned by their family. And it just really jolted me that happened.
One of the things that we're trying to address is both the incredible amount of resilience in the LGBTQ community here in Texas, and also the reasons why that community has had to develop that resilience.
This project took a mixed methods approach to the research, and it's really in two phases. So our first phase was a screener survey that we did. We included a lot of additional information into that screener that we didn't necessarily need to screen people into interviews. So there's one survey, then we did 82 interviews over the summer. And so we're able to look at the interview data, link it back to some of that original survey data. We've then built out some of the questions for our second phase survey that we're about to launch this month. So we're developing the queer ACEs, or at least could be a component of a traditional ACE measure that if you identify as LGBTQ, you'd be asked these additional items. Those items came directly from the interview data that we did. The resilient resources and strategies that we've come up with came directly from the interviews that we did.
In the general research, we heard a lot about adverse childhood experiences, this sort of young children experience. But for LGBTQ adults, there's this extra layer of potential family trauma around coming out and being understood and being legible and being accepted by your family that I think really shapes our adult health. And I think that's really, really important to really hear people's stories and to really listen to what they have to say. We don't know a lot of people looking at adverse childhood experiences in the LGBTQ community, and we're actually developing our own measure of those types of experiences based on our interviews and kind of trying to create a scale around that, because we think that some of them may be more important for understanding trauma and resilience for LGBTQ people than the standard ACEs measure. For example, on the ACEs, there's not a question about whether or not your family kicked you out of the home as a child for being LGBTQ, and that's a very traumatic experience.
Looking at resiliency within the community, what are things that are creating barriers or impacting our community, and what are the resources that they're using and utilizing to be resilient? But really, I mean, at the core of it for our agency and other agencies that are LGBTQ serving here in San Antonio, it's where do those gaps exist that could even make our community more resilient?
So how do we create a resilient community that can push back against that, not just in terms of marching and advocating and signing things, but creating programs that when people feel like they don't have a place, we can create that place for them.
I mean, I see things like, particularly for the LGBT community, I see things on like a positive trajectory, right? Where I'm like, okay, things have gotten so much better in the last 10 years, in the last 20 years. Like, give me some hope that like, as attention and knowledge about this community grows, that a lot of the bias that prevents us from having some of those access to resources will diminish.
You know, we want to live happy, successful lives. And I think through this project alone, I think we've been able to touch a lot of lives, not only within our own community, but also within our cohort of people that we are able to interact with across the U.S. and working in different disciplines and different fields. We've been able to bring a piece of San Antonio, a piece of the LGBTQ community, to create that understanding with others and hopefully build allies.
If we ask that question, like, what would you tell your younger queer self, right? And it's like, you can't go back and you can't tell that person, but you can tell somebody else. You can show up for somebody else. You know, if we can just get each other to be a little bit more empathetic and we can be a little bit more understanding. And I think not only have I learned that from working on this project, but I've definitely learned it by working with my project mates on this. And so if there was one takeaway about this project, it's, I think Resilience is really about understanding other people and showing up when other people reach out for help.
In a culture of health, I see everyone having access to resources they need to have wellness in their everyday life, including good housing, safe neighborhoods, and good health care.
In a culture of health, I see accessibility to all things that our community needs in order to thrive and be successful.
In a culture of health, LGBTQ individuals don't have to worry about being murdered. They don't have to be worried about being beat up, and they don't have to be worried about losing their jobs or their families.
I crave love so deep, the ocean would be jealous. I pray that some